Hi, my name is Dr. Rashmi Katari. I'm an emergency physician at Borgess Medical Center. We're concerned that your loved one may have had a stroke. A stroke is caused by a blood clot to the brain that decreases blood to part of your brain, so that part of the brain actually dies. Our goal is to try treating these very quickly so we can open up that blood clot and return blood flow to your brain. Your loved one may be a candidate for a drug called TPA. It is the only drug that's been shown to reverse the effects of an acute ischemic stroke. TPA is a very powerful drug, and like all drugs, there are good things about it and there are bad things about it. The good things about this drug are if you're the right patient and we get this drug to you quickly, we can reverse the effects of a stroke and improve your outcome. The problem with TPA is that it's a very powerful blood clot dissolving drug. It doesn't know a good blood clot from a bad one. So when you cut yourself shaving, you form a clot that stops the bleeding, which is good. This drug makes it so that it won't stop bleeding. Now we can stop that bleeding by putting our thumb on it. What we get more worried about is that your loved one's injured their brain, they've had a stroke, and you can have bleeding into the brain itself. That can be a really serious problem. It can lead to death or permanent disability. The key is to make sure that your loved one is a good candidate for this drug, and to make sure we get the drug in as quickly as we can. A lot of people ask me, if they get the drug, are they going to get better? And to be honest, I don't know. What I can tell you is that if I had 200 people with a stroke and I gave half those patients TPA and the other half I didn't, the group that got the TPA are more likely to do better. I can't tell if this patient or that patient is going to get better. I can just tell you as a group, they're more likely to get better than the group that I don't treat. So the first step is to make sure your loved one is a good candidate for this drug. There's going to be a lot going on. We're going to be starting IVs, we're going to be examining them, we're going to be sending off blood tests, and also doing images of their brain to make sure that they don't have a tumor or a bleed. If your loved one is a candidate for this medication, the next step is making sure that everyone is on board with giving this drug. So what will happen if we decide to give this drug? Well, the first thing that'll happen is we'll give some of the medicine through the IV, and then we'll hang the rest of it so it drips in over the next hour. Once that is started, we'll try to get them up into the intensive care unit where they'll be monitored very closely for the next 24 hours. Your loved one may not be able to help us with this decision due to their stroke. We need your input. It's critical that you start thinking about this now because every minute makes a difference. Someone from your stroke team will be in a few minutes to answer any questions you may have. Rest assured, you're in good hands.